Hello, my name is Heather Hembry, and my presentation today is around advocacy for Native American indigenous populations. The history of Native Americans. The indigenous people of the United States of America, they were the original people in the United States. The Native American population is made up of different tribes spread across the country. They have long-standing traditions of spiritual and cultural practices. They've faced genocide at the hands of European settlers and experienced cultural disruption and generational trauma at the hands of European settlers. The Native American population practiced long-standing traditions of living off the land, having spiritual practices and customs, and a focus of caring for the community and family. This was disrupted when European settlers came to North America and took over their land, disrupted their practices, and segregated the communities, which fractured their way of living. The history of genocide has been devastating to this population. Over 10 million tribal members resided before the settlement and were reduced to just over 250,000 people in the span of 4 years. The marginalization of Native Americans included segregated populations, which prevented progression. Their children were separated from their families and forced to practice European culture. Generational fracture interrupted growth and progression of cultural practices. They experienced trauma and genocide, which led to generational trauma, alcoholism, substance abuse, and domestic violence. Current policies are in place to provide autonomy in tribal practices, healthcare, and education. Segregation and loss of land continue to hold back tribal communities from having equitable opportunities. Tribal communities were segregated into small reservations, reducing their access to land and resources they had utilized daily. Children were removed from these communities and forced to go to schools that forced English speaking and Christian religious practices. The evolution of marginalization. Over time, the United States government and the tribes came together to address some of these issues. But in the meantime, tribal unity continued to happen as much as possible within the tribes. They began to return to cultural practices. The government started to give them funding for their tribes. They had the ability to govern from within, and they created healing within their communities. As the tribal communities began to pick up the pieces and address the trauma they faced, they turned inward and focused on their cultural practices of collectiveness and healing. Programs such as Wellbriety are found across the nation and focus on healing from trauma and finding cultural practice to support healing. Tribes of different nations have varying levels of wealth and resources based on the areas they live in, but many are thriving and providing resources to their communities such as medical, behavioral, and addiction services to further advance the healing of their people. Social policies for Native Americans include treaties that made arrangements for them to access exclusive land and natural resources. It helped them to build healthcare programs within their tribes, schools that were exclusive to the tribal community so they could teach from their own practices. The social policies put in place have assisted tribes in moving forward with their progression. Treaties from the United States government offered promise of safety, protection, and returned land. This had not put them back in possession of all land lost. Exclusive land and resources have provided cultural restoration practices of living off the land and a return to nature. Tribes can hunt and fish on these lands they possess with no outsiders able to utilize the land or resources. Healthcare and programs have been supported and growing to offer equitable care in medical and behavioral health settings on tribal lands. My advocacy plan included identifying a problem or the issue. The tribal behavioral health facilities in the King County, Washington area have low tribal employee census. The type of advocacy that I would be providing would be research to determine a desire from tribal members and how to promote a higher census of tribal behavioral health providers. The desired outcomes include determining if there is a need and then work toward advocating for paths to increased employee census of tribal members. The ultimate social justice related outcome for society would be to provide equitable employment opportunities for the tribal community and behavioral health field if desired by the tribal population. My social media campaign includes a flyer that asks the community a call to action to become healers for their tribal community. Explains that you can become a counselor. There's also other opportunities within that realm of behavioral health and medical, including being a nurse or an MA or a doctor. The social media campaign addresses the tribal community. It's a call for leaders in healing. It can promote access to following healthcare career paths and offer support in navigating the pathway. Culturally, tribal members want to help each other, and with the percentage of tribal members in this field being extremely low, this campaign could help provide more culturally centered care to the communities that the tribe serves. My survey questions included how interested would someone be in pursuing a career in healthcare in the tribal community, which areas of healthcare they're most interested in, what their current level of education is related to healthcare. Are they currently working in a healthcare related field? How important do they think it is for tribal members to staff their own healthcare facilities? What they perceive as the biggest barrier to becoming a healthcare provider in their tribal community? And sharing any other thoughts they might have. The 7 questions posed gathered interest, provide options in the broader area of behavioral health, inquire about current education, inquire about current involvement. Many tribal members work in entry-level jobs with no degree or license requirement. Cultural perception of importance of this concept, inquiry about perceived barriers to working in the field, and the survey also asked for any additional comments. My survey evaluation confirmed a desire of tribal members to serve their local community of behavioral health. Opportunity was their biggest barrier to achieve the desired results, and the plan is warranted and should move forward to campaign phase. The feedback given during the survey confirmed the advocacy proposal that tribal members do desire to provide care from a credentialed position within the medical and behavioral health facilities as needed. The barrier most voted for was opportunity. Surveyors noted that they didn't think there were many positions available to apply for. Within the community I serve, this is simply not true. This uncovered an interesting new development that will be useful when implementing the plan, helping to educate participants and potential participants that there are many opportunities may increase those who participate. Survey feedback also included a few comments. One person said, I think it's important for tribal healthcare services to have Indigenous employees to be able to give the patients a cultural understanding. Health isn't viewed the same across all communities. Indigenous staff are more likely to understand these perspectives without needing them explained, which helps avoid misunderstandings and makes care feel more respectful and relevant. I found this to be really on point. This is exactly why I decided that I wanted to look into this further, because I do understand that the white dominant culture is serving this community and there can be some disconnect in cultural understanding. Values and beliefs may differ, and having more tribal members involved could promote more engagement and more comfort. Another comment said more outreach services and classes available at tribal colleges for doctorate degree. So for me, I would like to look into that a little bit further, but it sounds like the tribal colleges maybe don't have that pathway, and they're asking for that as a potential opportunity. Evaluating my advocacy. Evaluating my advocacy plan would include identifying the number of participants engaging in the call to action, review the path progression from sign up to completion, and identify any challenges participants may face along the way, offering solutions to continue. Barriers included the plan, getting tribal approval for the first steps to recruit participants. Getting the tribe on board is the first step to make sure that I'm not stepping on any toes or doing something that somebody's not already doing or insulting them by assuming that I know what they want. The campaign, reaching the largest audience via social media, flyers, word of mouth, providing the surveys, finding enough tribal members to participate, and then data and collection and analysis. Connection needed time. Analysis was easily available to be reviewed via data collected. I'm looking forward to further pursuing this in the field that I work in. I feel like this is definitely something that I could put into action, and I'm excited to see where this takes me. Thank you. Have a good day.